Okay, so Miriam, today we actually have a new patient coming in for an evaluation, and then I'm just gonna go over his file with you so that way you kind of know a little bit of background of him. Okay,
Okay.
so we have Hiroko, and he is a 50-year-old Japanese Korean immigrant. He recently suffered a stroke, so he is experiencing some left side hemiplegia, spasticity, neglect, and some cognitive impairments. He also has limited active range of motion in his left upper extremity. And a little background on like his living situation. He lives with his spouse, his 23-year-old daughter, on a first floor apartment with stairs, and there is a wheelchair ramp in that apartment. He's a full-time bus driver, and he loves to hike and cook, and his pronouns are also they and them. So Miriam, based on everything that I told you, what type of frame of reference would you use for this evaluation?
Probably use a rehabilitative frame of reference since he would probably utilize some assistive devices to aid with his occupations of daily living.
Nice. And then, based on everything that I told you, would you conduct an MMT assessment at this stage of his recovery?
No, because an upper motor neuron, such as like a disorder like like a stroke, would be a contraindication for performing an MMT, just because of the spasticity and tone.
Yeah. Okay, so Kylie, based on what we observed from Hiroko's like observational performance, what two manual muscle tests would you want to perform on him?
Based on what I heard about Hiroko, the two manual muscle tests that I would want to perform on him would be the composite MCP flexion test on his left hand because he does want to return to cooking, and that requires him to grasp various types of cooking utensils, as well as grasping the steering wheel because he is a bus driver and he wants to get back to that. And then for the second manual muscle test that I would want to conduct on him would be the radial deviation test, as he does need to be able to maneuver the steering wheel for the bus, like I said, because those can be a bit heavy.
Perfect. And then you named two muscles to test. What other occupations besides those would we be able to do too?
So for the composite MCP flexion, that would be for carrying like heavy grocery bags. So he does want to get back to cooking. So he'll definitely have to go grocery shopping. So that would be an occupation for the MCP flexion. And then another occupation for the radial deviation would be wiping down the surfaces after cooking. So if he has to scrub anything, it would definitely take a lot of radial deviation. Okay, hi, my name is Kylie. I'm going to be your occupational therapist today. This is my student Jasmine. She will be assisting on today's evaluation if that's okay with you. If we can just start by getting a little bit of your brief information and background, okay?
Okay, my name is Hiroko. I am a Japanese immigrant. I'm 55 years old, and I go by they, them.
Perfect. Is there any other information you would like us to know before we start today's treatment?
No.
Okay, perfect. Thank you. Okay, so today I'm going to be performing your wrist extension as well as your thumb opposition. So I will be performing the first one, that will be the wrist extension, and then I'm going to have my student Jasmine hop in for the thumb opposition, okay? So first I'm just going to grab a towel roll here. I'm going to roll it up. And what I'm going to have you do is I'm just going to assist your arm up, okay? And I'm going to have you, perfect, rest right there. And the motion I want to see you do is, can you bring your arm up, your wrist up for me? All right, is that about as far as you can go? Okay, no worries. So in that case, I'm just going to remove this towel roll here. And I'm going to set your hand like so, okay? And now can I see you do that same movement? So just bring your hand back. Is that about as far as you can go? Okay, no worries. So I'm going to now assess your passive range of motion. So I'm going to just bring your hand back. I'm gonna do that one more time. Any pain with that?
Maybe a little bit.
A little bit. Okay, so now I'm gonna just come right here, okay? And what I'm gonna do is I'm gonna apply some slight pressure, and I just want you to resist me, okay? Ready? On the count of 3. 1, 2, and 3. Oh, okay. So that would be a score of a 2-. So that is significantly less muscle strength than we would expect to see, okay? But that's definitely something we can assess in occupational therapy, okay? And so I'm just gonna teach my student Jasmine for the next movement. So for thumb opposition, do you know what that would look like?
Like this.
Perfect. So we're just gonna have her do that motion, okay? And then if she's less than 50%, you're gonna have her do it gravity eliminated, okay? So I'm gonna have her hop in here, okay?
Okay. Hi, Hiroko. Nice to meet you. So I'm going to be assessing your opposition, okay? So I'm going to have you kind of turn this way. I'm going to help you right here. Okay. So I'm going to have you turn. We're going to turn it like this. Okay. Now, can I see you go ahead and do that motion? Any pain with that? They're just a little difficult?
Yeah.
Okay, so we're gonna switch the position. So I'm gonna have you scoot forward, and I'm gonna help you bring your arm up. So we're gonna bring your arm up like this. Okay, so I'm gonna assess it in this position. Okay, I'm just gonna move it. Okay. Perfect. Okay, so Hiroko, I want you to go ahead and do that movement on your own. Perfect. Okay, so I'm gonna have you keep it like that, and I'm gonna apply slight resistance, and I don't want you to let me move it, okay? Okay, so since she broke, it would be a score of a 2.
Correct.
Okay, so yeah, so you can go ahead and relax. Perfect. So yeah, so Hiroko, we gave you a score of a 2 because you were able to do the movement. However, when we added that slight resistance, you did break off a little bit. Okay.
I'm going to be performing elbow extension, okay? I'm kind of just going to be observing us. So if I can just have you lie down first. Perfect. So have you go ahead and move the elbow arm. Right here. And I'm going to go on the other side, so I'm better. Okay, let me practice over first. Okay, guys. So first, we're going to just ask our client here to just raise their arm as far up as they can towards the ceiling. Do you feel like you're able to do that, or is that too hard? No. Okay, no worries at all. So since they're not able to do it against gravity, I'm just going to have you sit facing that way. That's perfect. I'm just going to come to this side so we're able to see better. And then I'm just going to have her get her elbow 90 degrees up. Are you able to do that at all?
Do you want to kinda? Yeah.
Okay. So I'm just going to go ahead and assist you in moving your elbow to the outside, okay? And just seeing if you're able to do it, okay? Is that painful at all?
Just difficult.
I'm just going to try that one more time.
You know what?
Keep assisting you right here, but do you think you're able to move it out on your own?
Should I have you wait? Maybe.
Oh, perfect. Okay, so you're able to do it. So for this time, we're going to try it one more time. And I'm just going to go ahead and apply a little bit of resistance. Okay, just make sure you
The grade is a 2+.
don't let me move you, okay? I'm going to have you go right over here, okay? And through. Okay, perfect. So because you're able to resist, you can relax now. Because you're able to resist that, we give you a score of 2+, okay? So she got a score of 2+, so sometimes you can still work on your strengths a little bit more. Do you have any difficulty doing anything?
Yeah, sometimes it's hard to like bring my arm.
Like grab grocery bags and whatnot. Yeah, that should be definitely hard. Or even bring down a heavy bag could be hard for you. So this is something you can definitely address, okay? You feel okay about that, Kylie?
Yeah, that looks good.
Alright, Kylie, so now we're going to be doing shoulder external rotation. So if we're looking to assess strength against gravity, what way or what position would you like your patient to be in?
Against gravity, we would want to see this, and we would be pushing against, so internal rotation.
Right,
She's
so you'd be
resisting.
pushing down. Right, that's perfect. And if the patient is weak or unable to do it, what else would we do?
We would want to go to the gravity minimized or eliminated plane. So
Perfect,
elbow
yeah.
tucked, coming out, same thing, pushing in towards internal
Awesome.
rotation.
That's perfect. And obviously, a couple things that we want to be careful with. We want their feet to be flat on the floor. We want to make sure their thumbs are looking up, so when they're doing it, we don't have anything that obstructs the full range that we can get from them. And in gravity eliminated, what kind of resistance would you want to apply?
So we would want to start with the minimum resistance.
Perfect. Okay. Awesome. So you feel ready to do that?
Yeah.
Awesome. Okay.
All right, Hiroko. So first, we're going to start in that gravity, against gravity plane. So I want to see this motion here. Let's see how far you can get, okay?
I can't really go that much.
That's totally fine. Okay, so what I'm going to actually have you do now is tuck your elbow by your side, thumb's gonna be facing up, and I'm gonna test your passive range of motion here. Okay, so I'm gonna have you relax your arm against your side here. All right, and I'm just gonna stabilize. I'm gonna do this 2 times, okay?
It's really good that you're stabilizing right there too.
Good to know. Okay, and then I'm just gonna hold right here, and I wanna see you do that action on your own now, okay? Good. Perfect.
To maybe just have them try and do it maybe without adding any sort of.
Okay,
Good,
can
yeah.
I see you do that one more time, please? Perfect.
And just make sure their elbows tucked in. Yep. Perfect.
Good. Go ahead and bring it back in. All right, so now what I'm gonna do is I'm just gonna stabilize here, and I'm gonna push right against here, okay? And I don't want you to
Just try and resist.
right. All right, and 1, 2. Good.
Alright.
All right. So that would be a score of a 2
Just
plus
go
on
ahead
a
and relax.
2 plus on a scale of 0 to 5. So this is significantly less muscle strength than we would expect to see. But you didn't break against that minimum resistance that I gave you. So this is definitely something we can assess in OT, okay?
So Miriam, we're now going to assess Hiroko's pronation. And then do you remember what pronation looks like against gravity?
Yep.
Perfect. And then if needed, what would it be if we have to do it in gravity eliminated?
It would just be flat.
So yeah, you would put it right on the table,
Right.
and then you would assess it from there. Okay, so then when you're doing pronation, where do you want to stabilize? So you can do it on me and you can practice.
Right, okay, thank you. I would stabilize right here.
So you would actually want to use the pads of your
right.
hand. Okay, so you're gonna use the pads of your hand, and then maybe like around 2 inches, you want to apply that pressure. Good, yep. And then you can lift these up. You don't have to put the fingers on here. You can just put that pressure. Good, and then if we are assessing pronation, which direction do we want to move it?
Towards supination.
Perfect, okay, so if I do that, good.
Okay.
Perfect. Okay, do you feel comfortable performing it on Hiroko?
Yeah.
Okay, so go ahead.
Alright, Hiroko, so I'm just gonna go ahead and have you put your arm just like that towards the palms up towards the sky. And then let me just go ahead and rotate your hand as much as you possibly can towards your other side. Okay.
That's about as far as I can go.
Yeah, okay. No worries, you can go ahead and relax. So since we are not able to get a full active range of motion, this is something that we definitely can work on with Jasmine in your next OT session as well. And then we would assess strength after that. So yeah, so we give you a score of a 3-.
Perfect. Good job.
Alright, Jasmine, so we know that Hiroko enjoys cooking and driving. Do you think that he is within functional limit for shoulder flexion and MCP and shoulder flexion?
So based on everything that we saw in the scores that we got, I don't think his strength is within functional limits because he didn't have the full range of motion and he wasn't able to move the muscles against gravity, and that limits his ability to participate in his preferred occupations of daily living.